Alrighty, welcome to Wingate Pharmacy. I'm Jeremy. I'm your pharmacist. So I see here that you have a new prescription for the Advair Diskus. So have you been having any problems with your asthma?
Yeah, I'm already on albuterol, but I've still been having like coughing and wheezing spells.
Okay, is this like during exercise or during like normal daily routines?
It's mostly during exercise.
Okay, well, hopefully this medication will be able to help with that. Did your doctor tell you what this medication is used for?
No, not really.
Okay, it's an anti-asthmatic, and what that basically means is hopefully it will treat the symptoms of your asthma, so there will be less coughing, less wheezing, and hopefully like no tightness in your chest. Did your doctor tell you how to use this medication?
No, they said to ask you.
Okay, great. Alright, this is the Advair Diskus. It's also known as fluticasone and salmeterol. And the way you use this is you hold it like a hamburger, you put your thumb in the little thumb holder, and you open it. You hear that click, and you know it's open.
Okay.
Alright, and then before you use it, you push this down, and you'll hear another click. I'm not going to do it right now because it will open up and it will decrease in like the number of uses it has. Okay, and after you hear that click, you take it away from your mouth, and you exhale all the air out of your lungs. And after you have all the air out of your lungs, you bring this up to your mouth, put your lips on the mouthpiece, and you breathe in. And you hold that breath for about 10 seconds. And this will give the medication some of the time to work. And you will feel this powder substance kind of in the back of your throat, maybe a metallic taste. And even though that does taste bad, that is a sign that you know the medication has gotten into your system and it will work. So after that, you can close it and you can actually drink a glass of water and make sure you swish and spit. Do not swish and swallow because it could be dangerous if swallowed. Okay, and did your doctor tell you of any kind of side effects you might have with this drug?
Not really.
Okay, do you have any side effects with your albuterol?
Sometimes I get a headache with my albuterol.
Okay, well, this is a medicine very similar to albuterol, and you might have some of the same symptoms. You could experience dizziness or a headache, but one of the most common things is an upper respiratory tract infection like bronchitis or pharyngitis, just because the way the powder sits in the back of your mouth and the way it dries out your trachea and lungs. So if you do experience a headache, any kind of over-the-counter medicine like Tylenol or ibuprofen will be fine to deal with your headache. And if you have an upper respiratory tract infection, you call your doctor or come into the pharmacy and we will try to help you out and get that fixed up. Okay, do you have any questions right now?
No, I think I'm okay.
Okay, alright, for the storage of this medication, it should be stored at room temperature, away from sunlight, away from heat, and a cool, dry place. So, your albuterol, I know you've been on it for about 3 years, but I'm going to go back over just to make sure you are using your albuterol right. Okay, so first off, how do you use your albuterol?
Okay, I take the mouthpiece off, I'm holding it upright, I shake it, and then I exhale, and then I breathe in, and I hold that for 10 seconds.
Okay, well, it sounds like you have a great technique for using your albuterol. You do remove the mouthpiece, you do shake it up, you do exhale, and then you do inhale and push down the canister at the same time to get the medicine into your mouth, and then hold your breath for 10 seconds. And another important thing that you might have even forgotten to mention it, but try to every week with your albuterol wash the mouthpiece just to prevent infections.
Yeah, I'll try to do that.
So, but as for your Advair Diskus, do not wash this. Keep it dry.
Okay.
So, I have a couple questions concerning like the different medications because I know we did cover a lot of stuff today. All right, which one do you hold like a hamburger?
The Advair.
Okay, right. And which one do you hold up right?
The albuterol.
Okay. Which one do you shake before using?
The albuterol.
Right. Okay. And there are 60 doses. So, and you take it twice daily. Separate the dose by 12 hours. If you miss one dose and it's close enough to the next dose, say you wake up at 8 o'clock, then you take a dose by 9 o'clock. If you remember by about 10 or 11 that you forgot to take your dose, then be sure to take it. But say you're supposed to take it at 9 and you didn't realize it until 5 o'clock in the evening, don't worry, just wait until the 9 o'clock comes around and use your medication then. And because you use it twice daily, and there are 60 uses on here, you should be back in about a month.
Okay, so I should use this one in the morning once and at night once? Okay.
And just your albuterol, make sure you use it about 15 minutes before you start exercising.
Okay, sounds good.
Okay. Do you have any questions?
I think I pretty much got it.
Okay, do you have any known drug allergies?
I'm allergic to pollen and dog hair.
Okay. Well, this medication does have lactose in it, in the ingredients, so I just wanted to check, but you should be more than safe and fine with this medication. I do have a pamphlet here that contains some information. There is a section on exercising and asthma, so you might be able to find some pointers that will help you out.
Okay, thank you.
And I'm also going to give you the sheet where you have some information in case if you forget, but you are always more than welcome to call me if you need help.
All right, thank you so much.
Thank
It was
you.
nice meeting you.